It's your show now.
Start?
That's
Good morning, everyone, or good afternoon. Welcome, everybody, and I'm super excited to have you here today. I am Helen Arteaga Landaverde. I'm the Chief Executive Officer for New York City Health and Elmhurst. I'm thrilled to have you here today in our beloved hospital. We are so excited to close out Healthcare Week of Action with our partners. Yes, woohoo! With our partners, New York City Cares and Get Covered NYC. Yes. At Elmhurst and at all New York City health and hospital facilities, we do not turn not one single patient away. We encourage everyone from our communities to seek care without fear. Through NYC Cares, New Yorkers can have access to health coverage regardless of immigration status and ability to pay. If you are a new patient in New York City Cares, you get an appointment within 2 weeks. That is true evidence not only of commitment, but of action. A key element of our approach and its success is that we provide this care not only with excellent clinical access, but also culturally sensitive. More than 1 million New York City health and hospital patients speak over 200 languages. Interesting fact, here at Elmhurst Hospital, we speak more languages than Google. Google only speaks 109. Yes, Elmhurst speaks 128. I think they have some catching up to do. But really, I'm super grateful for everyone that's here today and this commitment to healthcare. I've seen it firsthand how it can impact someone's life. I'm a first-generation immigrant. I'm a patient of Elmhurst, and I'm now its CEO. Without good healthcare and being healthy, I wouldn't be standing here today. So I'm super grateful. I really want to thank you, Mayor Eric Adams, for your leadership in ensuring that all New York City health employees have an amazing job. But also, more importantly, that every New York City resident and everyone living within our walls has access to healthcare. And I really want to thank you for that. I want to thank Adrian Lover for the Mayor's Public Engagement Unit and Dr. Hameznes, who also was born here at Elmhurst, for their efforts to connect New Yorkers to affordable healthcare access. Lastly, I want to thank all the people that made this week possible, because to get this done takes a lot of people and a lot of energy, as you can see here. I want to thank the Mayor's Public Engagement Unit outreach specialists. I want to thank our future public health advocates from the CUNY Career Launch Interns, which is about 100 of you guys. And I want to thank all of our partners who are here today, from the press to everyone who's tabling. Thank you for your commitment to healthcare and to our beloved city. And now I will pass this along to Adrian Lever, the Executive Director of the Mayor's Public Engagement Unit. Thank you and welcome.
Helen, thank you so much for having us here today. I am so thrilled to be here at Elmhurst with our partners at NYC Care, Health and Hospitals, and of course our Mayor, Eric Adams. My name is Adrian Lever, and I am the Executive Director of the Mayor's Public Engagement Unit, which oversees the Get Covered program. All of our staff here today. My team spends every single day out in communities connecting people to the services that they need and making sure that they have everything they need to get through the enrollment and application process. Through this work, we're able to see firsthand the ways in which city, state, and federal programs can serve New Yorkers in need. There are so many resources for people who are struggling with housing instability, with financial hardship, and when it comes to healthcare, we have low-cost and even free options through programs like NYC Care. It is incredible to see the ways in which New York City serves New Yorkers, but the problem is, with a city of this size and so many resources available, it can be really hard to know where to turn. And that is why our staff are here to make that process easier. Since January alone, our Get Covered team over here has reached out to over 40,000 New Yorkers to have conversations about healthcare. And our tenant team, some of the staff are here also today, have had over 38,000 conversations with tenants about housing instability, about opportunities to get rent relief for programs like with seniors who need to stabilize their rent to stay in their homes. And we also, through projects like our amazing CUNY program, have been able to add capacity to do outreach around things like the Affordable Connectivity Program that are getting people access to discounts for internet. We've also done work around fare fares to make sure that we have access to transit. And the reason we do this work is because we know at PU that healthcare is not just about having access to a doctor. It is about having all of the resources that you need to live a life of dignity and respect. And we're so grateful to our team at Get Covered to doing that work every single day. Many of our interns are here. Raise your hands. CUNY interns. Woo! Our interns and our staff from the Public Engagement Unit are out all summer, not just talking about healthcare, but also all of these other benefits that are available, providing comprehensive benefit screenings to New Yorkers. And then our specialists who speak over 20 languages are going to follow up and make sure that everybody gets the help that they need throughout the entire process. We know that a strong government is not built by waiting for those in need to come to us. It is our obligation to go to you, to show up at your doors, in your communities, on your phones, to make sure that this process is working with the city is seamless. And we know there's so much more work to do. It is not done, but I'm incredibly grateful to be working with an administration that is working so hard and dedicated to making this process easier for everyone. So I'm thrilled to pass the microphone over to our mayor, Eric Adams, who's leading that charge.
Thank you. This is the Public Engagement Unit and our CUNY interns. And I know sometimes, this is like a Karate Kid moment. When he was supposed to wash the car, then he learned that he was actually learning karate moves in the process. And what our CUNY interns, what you're doing, I'm a two-time CUNY grad from New York City College of Technology and John Jay College. And what you are doing is that you are harnessing the real education. Education is not what takes place in the sterilized environment of a classroom. Anyone could be academically smart, but you're becoming emotionally intelligent. When you knock on the door and you're seeing face-to-face with someone who's experiencing a hardship, who's going through a difficult time, you are, peeking into the lives of everyday New Yorkers, and you're removing the barrier of leaning into healthy discomfort. I tell people all the time, I'm socially awkward. I'm an introvert. I'm extremely shy. It's hard for me to engage with people. But when I lean into that discomfort and communicate with people, it made me a better human being. And at the beginning of your lives, you are engaging in people. There's nothing more difficult than engaging with a stranger. But you're not only engaging with the stranger, you are also giving them the things they need. Do you know how many people don't access services because of a language barrier, or they're afraid of government, they're afraid of their status? My mother used to go and she would walk out of a city agency and say, I would rather go without than feel the way I feel. I feel more broken before I walked into the governmental agency than when I walked out. And so what you are doing, you just see it as, hey, we're volunteering and we're helping. No, you're not. Not just volunteering. You're the difference between people being able to go and get health care if they need it. You're the difference than people who would have to jump to turnstile because they don't have enough to pay for their swipes by telling them about the reduced fare Metro card. You're the difference in telling people there is help if you're about to lose your home. And so what you are doing, you're helping New Yorkers. And I know just by looking at your faces, you know how important it is, because many of you are probably first-generation arrivals to the city. You know what your families went through. You know what it is to have English as a second language. You know what it is to be denied. You know what it is to walk into a governmental building and not have the basic help to fill out a form. So you're not only helping others, but you're helping yourselves, because there's a process that we all need as we transform into the New Yorkers we want. Out of all of my units and agencies, This is an agency and unit that I just adore, you know. The Public Engagement Unit. The Public Engagement Unit. You are publicly engaging with people who have given up on government. They've given up on themselves. They've even have given up on hope. You knock on that door, you ring that bell, you talk to someone, you're planting the seed of hope. They're now thinking differently about themselves. And so I just really thank you. I want to go out with you sometime. I want people to see that their mayor also cares. I want to walk the streets with you. This is the best part of the job. The best part of the job is that one-on-one. And I encourage you, as you go home at night, make an entry in your journal. Talk about the stories you had that someone that didn't have health care, you signed them up. Talk about the person you spoke with. Start documenting this wonderful experience that you are having. And don't allow it just to be a passing moment. Enjoy this moment. Soak this up. My job is hard. Being the mayor of the city of New York is one of the most complicated and difficult jobs you could have in government. But I say every day that I wake up, when does the hard part start? Because it's not hard for me. I love every moment being the mayor. Every moment being the mayor. And I want the challenges that it offers. Love every moment being a CUNY intern. Love every moment of going through this experience. Leave this summer different. Leave this summer with a true purpose. And to this team that's here, Elmhurst Hospital, everybody I meet, they tell me they were born here, you know? To this whole team, this is the best part of our city. And I want to end on this note. I was teaching a young man when I was the borough president, and even when I was a senator, I was teaching him the pronunciation of words, and one of the key was to put the hyphen on the right letter so you could pronounce the word correctly. And he noticed, he says, so based on where you put the hyphen is how you pronounce the word. That is an analogy to our life. We put the hyphen on the wrong moments in our lives. And so we have a mispronunciation of our lives. Put the hyphen in the beauty of our lives. Start pronouncing your life based on the beauty of it, not based on the hardship, not based on a difficult moment. Put the hyphen in your life in the right place, and you're going to pronounce your life with the beauty that it has to offer. That's what I want to uplift. Not where we disagree, but where we agree, and what we can get done because we agree. It's a great moment for our city that we can sit down together and say, let's go help those who need help and meet them where they are and take them where they ought to be. I'm excited about this unit. I'm excited about the young people. I'm excited about your future. I'm excited about where this city is going. Don't let anyone kid you. Our city is invincible. We're invincible not because of the Empire State Building, Broadway, all the other great things. We're invincible because, like Snapple Soft Drink stated, we're made of the best stuff on earth. We're New Yorkers. Thank you very much.
Thank you so much, Mayor. I mean, this job is rewarding, but we all know that it's also exhausting. It's hot out there, and I know that the team really appreciates those words of inspiration. I'd like to pass it over to Dr. Jonathan Hameznes, who is the director of NYC Cares.
Thank you. Thank you so much. Thank you so much. I'm very excited to be here. It's really an honor, as Helen shared. I was born here, so it's kind of coming full circle. I'm Jonathan Hameznes. I'm the executive director of the NYC Care program. And NYC Care really is the program that welcomes folks who are excluded from insurance because of their immigration status, because of their ability to pay. So NYC Care says, hey, you have a right to health care if you're a New Yorker. So come enroll. And we already have, next week, we're going to hit 3 years of the program's existence. Big round of applause for that. And we've enrolled over 110,000 members who've made hundreds of thousands of appointments. We already have the data to show that, folks, after they enroll in the program, we're seeing improvement in their diabetes, improvement in their hypertension, but we know we needed to do more. And so this administration, a few months ago, eliminated the 6-month residency requirement because they said, you know what, actually, Mayor was the first to say, if diabetes doesn't wait, can't wait 6 months, we shouldn't wait 6 months either, right? But the most powerful thing for me as a family physician is the stories of my patients, members who come to me. I had a patient recently, a single mother of 2, who had developed severe lower back pain, constant, had 2 children. She was worried, tearful every day, worried about what would happen if her back pain didn't allow her to work. What would happen to her children? And then her friends, friends like you, told her about NYC Care, that she could go enroll no matter her immigration status. We're taking care of her. Her back pain is starting to improve. And you could just see the weight lift off her shoulders, that she knew someone had her back. She knew New York City had her back. And she knew, I'm going to share with you this card, right? This membership card, that with this membership card, she could go anywhere in New York City Health and Hospitals and get the care that she needs, including at Elmhurst Hospital. We have 60,000 members, Helen told me, just at Elmhurst Hospital. So I'm really thrilled about this partnership, and I think this is just the beginning, right? So thank you so much to Get Covered, the Public Engagement Unit, the CUNY interns. It's really, I was out there pounding the pavement with you all. It is hard work, in fact, talking to strangers, getting them to open up. But people were excited to hear what we had to say, that we were welcoming them into all sorts of benefits the city has to offer. And I'm looking forward to many more partnerships moving forward, because I know that there are more people like my patient who need to hear that welcoming word, that invited into all of the benefits, including healthcare through NYC Care. So if you know anyone who needs access to healthcare, remember we have a 24/7 hotline, 646-692-2273. Thank you, Mayor Adams, for your leadership, making sure that everyone has access to healthcare. Thank you to Adrian Lever. Look forward to many more partnerships, and thank you to Helen for all your work, making sure this hospital runs as seamlessly as it does. So thank you.
Thank you so much, Dr. Hameznes. I now have the distinct pleasure of welcoming one of our own at the Public Engagement Unit. She is a Get Covered specialist who has an incredible personal story and a story about supporting one of her clients recently, Tanya Navas.
Good afternoon. Today is a privilege to be standing here representing one of the public engagement units, one of the team, which is Get Covered NYC, and to share the work we do, which is to assist and educate about the different healthcare options New York City residents have access to. I see Get Covered NYC as the team that opens the door to our clients, not only to be enrolled with New York NYC Care, or health insurance, but as the door that opens and creates trust between the city services and New York City residents, especially our most vulnerable and underserved communities. Recently, we received good news from one of the many clients we serve, Sandra, whom I had the opportunity to assist. Sandra was referred to our program because she was diagnosed with cancer. When I first talked to her, she was worried, she was uncertain. She didn't know if she qualified for her treatments. I assured her she will be treated regardless of any immigration status by enrolling with NYC Care. After educating her about the program and other services available, she was enrolled, and now she's ready to receive treatment at a city hospital. Today, I just want to share how she described her process, and I quote, more than connecting me with health coverage through NYC Care, she gave me baby steps about how to find treatment to feel the way I do right now. I feel safe. I feel proud to be part of Get Covered NYC because that's one of our goals. We want to make sure New York City residents seeking assistance feel safe and understood during the process. The Get Covered NYC team is as diverse as our city is. Our background is so different, the different language we speak, and the experiences we have. This gives us the advantage to connect and to understand our communities so they can feel safe and assured they will receive the healthcare services they need. Get Covered NYC team is here to help you to understand, to educate you about the healthcare options. So if one day you receive a phone call from us, or if you see us in your neighborhood, please be assured we're reaching out to help. A mi comunidad que habla español, recuerden que el programa de Get Covered NYC está para ayudarles con sus preguntas de cuidados de salud que la ciudad de Nueva York ofrece. Llame al 311, envíe un mensaje de texto a Get Covered NYC o cobertura o seguro de NYC en español al 877-877 o visite la página web newyorkcity.gov/getcoverednyc para conectarse con un especialista de Get Covered NYC. Gracias. Thank you.
Thank you so much, Tanya. I'm now going to invite our mayor back up to introduce our next two speakers.
Yes, our great council members. First, Councilman Moya, who was born in this hospital. All right, Councilman Moya.
Thank you, Mr. Mayor. Thank you to everyone. I have one up on Dr. Hameznes because not only was I born at Elmhurst Hospital, but I worked at Elmhurst Hospital, and I proudly represent Elmhurst Hospital as an elected official. So I want to say thank you to Helen, to the mayor, to Dr. Hameznes, Adrian, my colleague as well, Lynn Schulman, who's here. Look, this is an important moment for us as a city. What we saw, the devastation of 2 years ago, this right here was the epicenter. All across the globe was the picture not too far away, right around the block, of those long lines of immigrant people that live in this community, like myself. I'm a son of immigrants. My parents immigrated here from Ecuador. To me, the importance is that we need to ensure that we close that gap in which the inequities continue to exist in our city. The mayor is doing that and making sure that we are making healthcare accessible to all New Yorkers. And so to the team that is out there each and every day for New York Cares, we thank you. We thank you, and we thank all the interns who are out there. Listen, as politicians, we know how hard it is to go knocking on doors, okay, in the heat, and we understand that. But you are serving a great purpose here, as the mayor said. You're going to make a difference in the lives of so many immigrants who don't really trust government, who have consistently come through the emergency room door to get health care because by the time they came here, they're already terminal. We need to get that primary access. And that number that they talk about, 110,000 and then 60,000 already coming from this hospital, is saying a lot about the need in this community and others throughout the city. So continue to press on because we can make the difference in the lives of so many. And we are eternally grateful for everything that you are doing here because you are making a real difference in the lives of New Yorkers, your neighbors, your family, your friends that will have the ability to enroll in healthcare. And we can do so much that will really embrace what this mayor and this administration is trying to do, and that's access to healthcare for all. So thank you very much for that opportunity to be here with all of you. Unas palabras en español. Quiero dar gracias al alcalde, a todo el equipo que está aquí de Elmhurst Hospital. Es sumamente importante que nosotros tengamos el acceso a seguro médico. Vemos que esto fue el epicentro de COVID. Sabemos que la comunidad inmigrante es la que sufrió mucho durante este proceso. Este programa que tenemos aquí es el programa que va a dar ese paso tan importante para que toda la comunidad inmigrante pueda tener acceso a seguro médico y tener algo tan positivo que nosotros podemos hacer para mejorar las vidas de todos los neoyorquinos. Gracias, que Dios les bendiga.
And finally, our amazing health chair in the city council, Councilwoman Shulman.
Thank you. The first thing I want to do is I want the interns to give themselves a round of applause. My first 2 years in college, I went to a CUNY school, a CUNY college. So I just want to say that I was not born in Elmhurst Hospital. That said, I grew up in Forest Hills, which is my district, but I actually was born and raised in Elmhurst. I went to PS 89. So I want to say that. And I also have been a consumer of Elmhurst Hospital. So I want to say that. And I want to tell you something about our mayor, because I think in the front here it says get stuff done, if I remember correctly. If I looked. Yes, it does. He does. And I want to also say that I'd love for the public engagement folks to come out to my district, and I will walk with you because I think it's so important. We have a lot of elderly in my district, a lot of older adults who it's one of the highest number in the city for council districts. So I'd love to do that with you. So healthcare is a human right, which is why it's so important for us to be here for New York City's Healthcare Week of Action. I want to thank Mayor Adams for his unwavering commitment to healthcare, which was born out of his own health issues as a young man. And as I am a recent breast cancer survivor, so I can tell you firsthand how important preventive and primary healthcare is to me as an individual and to our city. The COVID-19 pandemic is the biggest healthcare crisis of our lifetime. Tragically, the coronavirus exposed the deep vulnerability of our communities. In fact, Queens was the epicenter of the virus, and New York City Health and Hospitals Elmhurst was the epicenter of the epicenter. And I just want to mention, by the way, that my colleague, Councilmember Moyer, was an elected official before I was, and he's been a mentor to me, so I want to thank him for that. In addition, over the past 2 decades, Queens has lost an alarming number of hospitals and other healthcare resources. The consequences have been devastating. We have lost loved ones, friends, and neighbors. The lives lost underscore that there's nothing more important than access to health care, particularly preventive and primary care, which is why I have dedicated my personal and professional life to healthcare advocacy so that Queens and every other borough has equitable access to affordable healthcare services. We need a healthcare system that, in addition to providing affordable preventive and primary care, must also have the ability to react to acute issues such as COVID. Thankfully, we have 2 programs to address the basic healthcare needs of New Yorkers. The New York City Care Program to connect people with primary care and get covered NYC to help New Yorkers in the 5 boroughs enroll in health insurance, including low or no-cost options under the Affordable Care Act. Back in February, the New York City Care Program enrolled its 100,000th member and is in the process of enrolling many more, which I'm very, very happy about. I can't wait to hear about the new milestones that are reached because that means that many more New Yorkers are being kept healthy or on their way to a healthier life. As a Queens Council member and chair of the City Council Health Committee, I look forward to continuing to work with Health and Hospitals and the Department of Health and Mental Hygiene in making our lives better. And I want to tell you something. This mayor is the person to make sure that we are a healthier New York in the end. Thank you.
I think that closes out our program. For those of you who are out.
No, 1 second. I just want to ask the mayor, Mayor Vernice, I just want to ask you, please, I'm one of the Staten Islanders. I came away from Staten Island because I want to meet you in person and be here with everyone, but I want you to come and walk with me in Staten Island, please.
I would love that. Done.
So I just want
All right.
to get a picture.
She got a commitment. This is the public engagement. We take our opportunities where they come. All right. Thank you guys for canvassers. Go back out into the field, and we will see you all soon. Thanks, everyone.